Double outlet right ventricle. Double outlet right ventricle, DORV, is a complex congenital heart defect that gets its name from the cardiac anomaly involving the right ventricle outflow, in which both the aorta and the pulmonary artery arise from the right ventricle. Normally, the pulmonary artery connects to the right ventricle and the aorta connects to the left ventricle. There is usually a ventricular septal defect present, which is a hole in the septum between the right and the left ventricles. Oxygenated blood comes from the lungs and goes to the left ventricle. With DORV, it can't leave like it normally does through the aorta, as the aorta is placed into the right ventricle of the heart. The only place for the blood to go is through the ventricular septal defect, causing oxygenated blood to mix with oxygen-poor blood and sending it out into the body through the aorta on the right side. The body then is not receiving enough oxygen, causing your heart to work harder. In 1957, Witham introduced double outlet right ventricle as a diagnostic term for the partial transposition complex. The earliest report of double outlet right ventricle was published in French in 1703. In 1793, John Abernathy, assistant surgeon at St. Bartholomew's Hospital in London, described partial transposition of the great arteries. Ventricular septal defects associated with DORV is subaortic VSD, where the VSD is just under the aorta, subpulmonary VSD, where the VSD is just under the pulmonary artery, and doubly committed VSD, where the VSD is under each of the great arteries, and non-committed or remote VSD. The VSD is not near the aorta or pulmonary artery. Congenital heart defects are among the most common birth defects, affecting 40,000 births in the U.S. each year. DORV affects 1 in every 10,000 babies. Survival rates are increasing, but there remain gaps in risk factors and prevention. DORV affects the circulatory system and the respiratory system. Children with DORV have a hard time pumping enough oxygenated blood through the body, causing the heart to work harder, causes high blood pressure and heart failure. Surgery helps blood to flow out of the body and lungs as it normally would. Extra pressure from the blood going to the lungs can damage the lungs' blood vessels, leading to heart failure along with breathing problems, which is why surgical intervention is necessary. Symptoms of DORV can include heart failure, cyanosis, failure to thrive, feeding and weight gain difficulty, heart murmur, tachypnea, sleepy or unresponsiveness, tachycardia, and profuse sweating. DORV can be diagnosed prenatally through ultrasound and fetal echocardiogram. It can also be diagnosed after birth through an electrocardiogram, echocardiogram, pulse oximetry, chest X-ray, and cardiac MRI. DORV requires open heart surgery. The most common surgeries used to repair DORV are intraventricular repair, which is when a patch is used to make a tunnel from the ventricular septal defect to the aorta. When the heart contracts, the oxygenated blood in the left ventricle flows through the VSD into the aorta. After the tunnel is in place, there is no longer any mixing of the oxygen-rich blood and oxygen-poor blood in the right ventricle. An arterial switch. It's when the aorta is moved from the right ventricle to the left ventricle. The VSD is then patched to keep the blood from mixing in the ventricles. The last common surgery used is a single ventricle pathway. In most cases, this repair needs 3 surgeries to balance the blood flow in the baby. The first surgery of that series is usually between birth and 2 weeks. It's a Blalock-Taussig or BT shunt. It redirects some of the output of the left ventricle from the body to the lungs, or if the blood flow to the lungs is too high, like with a large VSD, a band is placed around the pulmonary artery and it lessens the flow to prevent damage. The second procedure is usually 4 to 6 months of age. It's called the Glenn procedure. It allows blood returning from the upper part of the body to flow directly to the lungs. The BT shunt is removed at this time. The third surgery is usually between 1.5 to 3 years. It's the Fontan procedure. It channels blood from the lower half of the body to the lungs so that the heart pumps oxygenated blood to the body only. Blood returning from the body goes to the lungs before passing through the heart. Cardiac-related jobs will always be in demand, especially with the increase in diagnosis due to modern technological advancements. There are pediatric cardiologists that diagnose and treat heart defects working closely with surgeons, pediatric cardiothoracic surgeons who provide surgical intervention for newborns through teenagers who need heart surgery. There are pediatric perfusionists who operate the heart and lung machine, keeping the blood circulating as it should during open heart surgery. Cardiac echocardiographers who provide images of the heart to help aid in diagnosis of the heart defects like DORV. Pediatric cardiac care nurses, specialty care nurses that provide and care in cardiac units. Cardiac cath lab technicians that assist in insertion of catheters into the heart, measuring and administering special fluids. Patient navigators that support families of recently diagnosed in navigating appointments, keeping records, accommodations, transportation, and other resources. Those are just a few of many cardiac-related jobs in the field. Some of the technology advancements include 3D cardiac imaging that allow cardiologists to get an in-depth look at the heart, 3D printing of the heart to prepare for a complex surgery, as not every patient is the same, cardiac cath, balloon dilation and stents for the blood vessels, heart valve replacement, and heart transplantation. Thankfully, to the enormous strides today, most kids go on to live an average lifespan after surgery, as long as they are monitored by their pediatric cardiologist routinely. It is important to transition to their adult cardiologist to make sure they don't need any more surgeries or medication down the road. Thank you for taking the time to learn about double outlet right ventricle.